Hi, I'm Dr. Ben Newman. I'm a coronavirologist. Let's answer your questions. The next question is from Diane. Hello again, Diane. Let's see. All right, we got two questions. Fine, we'll answer them both. Um, First question is about virus variants. How effective are the current vaccines against the current variants? Yeah, would you be surprised to know the answer varies? Would you? um, I would say, from what I've heard, generally you take how effective the vaccine is and you knock off about 25 of those percentage points. So a 90 goes down to a whatever 65 ish. That's the right ballpark. Now the Johnson and Johnson vaccine they are claiming works just as well against the Brazil and South African variants, which I think they may have got lucky on a small sample size, but given that they are working with the exact same version of the protein, still the original version, as every single other vaccine out there, I don't really see how theirs would be special or different. There's not. Just very sorry, Johnson and Johnson. There's nothing all that special or different about it. So yeah, I think the answer will be a bit less, but definitely not zero. So what you get with the vaccine is that you'll make all these antibodies and you'll also make all these T cells. So assume that whatever's happening for antibodies is happening to some extent for all the other cells in the immune system that are that have immunological memory, that can remember a bad thing that happened and then learn how to fight it and whatever, the helpful side of the immune system. Um, so we have those cells, they can be trained with vaccines, and that's great, but we're using the original version still of the spike for training, the version from late 2019 from China. And since then, we've had something like now around 15 different waves of virus that have come in and pushed out the old virus pretty much. And yeah, taken over one after another. Yeah, and you've heard of some of these. They're the ones in the news. But there are a lot of ones that haven't really made as much news, but still have been very widespread. So, um, as these variants change, they get a little bit more and more different from the original. So now, if you look at the entire 30,000 base genome of the virus, you've got, if I remember right, it's somewhere between 20 and 65 mutations within this group that we call the UK strain, which is not one thing, it's a whole bunch of different things that are just a particular branch of the family tree, we give that name to. And so each one of these is genetically a little different, but they're all still pretty close. Nice thing about the immune system is it sees the world in little tiny patches. So an antibody, some of them just bind a small bit. I think the really big ones might bind like 15 or 20 amino acids at the same time out of a protein. Spike, though, has got, if I remember right, around 1,250 amino acids. So we're still talking very small percentage. Things like T cells, there are a couple different kinds, and they're generally going to recognize somewhere between about 9 amino acids and at the high end, maybe like 15, although there's one version that has like an opening at the end, so it can hold longer things in there that don't necessarily do anything, but could do a little bit. So, yeah, we see little tiny bits of the protein. And so, even though 65 mutations sounds like a lot, you're talking about 65 out of 30,000. So, if it was 30 out of 30,000, that would be 1 out of 1,000 nucleotides. Yeah, it gets changed. Or 1 out of, yeah. And so, we got about 2 out of 1,000. Yeah, 0.2%. Yeah, 2 out of 100 divided by 10. So almost all of the protein is still identical to the original version. Um, and so we talk about how these are so much harder to knock out. When we do that, we're focusing on one tiny population of antibodies. They're called neutralizing antibodies. They're super useful, but they are by no means the only thing that your immune system has to offer. So, what we've seen with all the vaccines is even when the virus makes a change, and there's only a tiny little patch that the neutralizing antibodies can bind. And when they change that patch, you're going to lose some, yeah, of your neutralizing antibodies. It happens that way. And that's what we've seen. So that's why you have decreased overall effectiveness. Some people still get the virus, but you still have the rest of the immune system there, which is why, with all the vaccine studies that I've seen, they all seem to protect against both severe illness and death to a very large extent. And that's really what you want, right? Yeah, we go through colds and sniffles and all sorts of stuff. And if we can knock COVID-19 back to the point where it is basically, yeah, survivable and mild for everybody, yeah, that is a partial win, because we also know that the vaccines prevent the virus from growing in people to a large extent. And so the more you vaccinate, the less virus there will be around, and the fewer places the virus can go. The virus has to jump, literally has to jump from one person to another, to another, to another. And if it cannot get right into the face of another person who's probably not wearing a mask and has not had a vaccine within a very short time, like a couple of days, then the virus just dies out and it's gone. We literally have to just not mess up for a relatively small amount of time, and we win. Yeah, which seems very counterintuitive and borderline impossible. I know, given everything that people have been through, but that's what it is. And so the vaccine's a big tool. Vaccine's going to help. Yeah, I think I over answered your first question. Let's look at your second one. I think I might have answered that already. Should an adjustment to current vaccines become necessary? Which it's getting there, yeah. Like for the South Africa variant, as you correctly point out, yes, you know your stuff. Will the vaccine adjustment require the same process of long clinical trials? Now, I am not clear on that yet. The question would be, did they... Yeah, that is like an FDA decision matter. If you were to change, I don't know, 5 amino acids to turn one variant into the important components of another variant, would that constitute a totally start over again vaccine? I don't see why it would, because with the flu vaccine, there is a blanket approval. They just each year figure out what the strain is going to be, or the 4 strains for most flu vaccines. And they put them in there, and they don't have to go through a full clinical trial, or else you and I would never get a flu vaccine in time. It would be years after that flu had passed, and it would be useless. So the mechanism does exist. It's a question of how do the people, and yeah, I realize it's not just America out there, how do the people in all the equivalents of the Food and Drug Administration, all the people that are reviewing and approving these drugs, how do they feel about that? So every country, I believe, has a process to do this. And yeah, it's down to convincing people, talking to people. Yeah, old school politics, I guess. So I think it's possible. I think it's very possible that they would not have to go through that. And that'll be good. And really, that's what we need. So yeah, after your first 2, it may end up being in summer. We're going to have a booster vaccine with a little bit of South Africa or whatever terrible version of the virus is knocking around at that point and posing something of a problem. But I think it is well within the range of what these vaccines can do and what they can do to stop it. So thanks very much. I'll answer the phone, and you have a good day. This has been Ask Dr. Ben.